Hi, I am Dr. Vikas Gupta, Director Hand to Shoulder Clinic. Today we will be talking about very common problem of the shoulder, which is rotator cuff injury. Rotator cuff injury is seen in mainly two age groups. One is young, one is old. Younger ones usually is because of the trauma. In older population, it is because of degeneration. Degeneration means the rotator cuff becomes weak and minor trauma, or sometimes spontaneously it just gives away. Before talking about rotator cuff injuries, we must know what is rotator cuff. Rotator cuff is muscles. There are four muscles which are around the joint. You can see these are around the joint, muscles going anteriorly, superiorly and posteriorly. Anterior muscle is subscapularis, superior muscle is supraspinatus, posteriorly there's teres minor and infraspinatus. So main function of rotator cuff is to stabilize the shoulder joint as well as help in the movement of the joint and guide the movements in different rotation and abduction. Whenever there is an injury to the rotator cuff muscles, first thing is we have pain because there's an injury or tear in the muscle. Second problem comes is weakness of the movements because one of the muscle is torn, therefore the power of the shoulder decreases, that causes weakness. So let's talk about rotator cuff in young adults. In young adults, it is mainly because of the trauma, repeated trauma or acute trauma, in which because of the injury, muscle is avulsed from the bone and muscle is avulsed from the bone. So in these cases, because muscle is good quality, so we can refix the muscle. So in acute patients, in acute trauma, the line of treatment is acute repair, and which gives very good movements or very good function after proper rehabilitation. How we do it? It's very simple. We put in our scope into the joint, look at the tear and refix the tear with the bone and wait for tendon to heal and proper rehabilitation, which results in almost normal function. There is other set of patients in which old age, there's a chronically the rotator cuff is weak because of the age, or because what happens many times, this is the bone what we call acromion, which there's a spur. So every time shoulder moves, it hurts on the or pinches on the tendon, and because of the chronic injury, the tendon becomes weak and it gives away one day. So in these cases, again, arthroscopically we go inside, repair the rotator cuff, and as well as we shave off the bone which was impinging on the tendon and increase the space. So this surgery again can be done arthroscopically. But there's another set of patients which are old, in which there's a degeneration of the muscles as well as there's a gap at the rotator cuff. That means it is very difficult to bring the edge of the rotator cuff back to the bone because of the retraction, because of the old injury, or because of the degeneration. Such cases, the acute repair is not possible. In these cases, if patient is old, we directly go for a replacement. In replacement, it's a special kind of a replacement, what we call reverse shoulder arthroplasty, in which we put a head on the glenoid side where the cup was there. We put in a head and cup comes on the humerus side, which is originally which was a head, which changes our biomechanics and lever arm, so that the muscles of the shoulder, that is deltoid, which helps in abducting the arm or lifting the arm. So this is another set of a problem in which for rotator cuff arthropathy we do the shoulder replacement. Therefore, we have seen that different situation, same problem has to be dealt differently because of the age, because of the condition of a tissue, because of the arthritis. Therefore, we always say whenever there is an injury, we have to see the doctor who examines you properly, looks at your images and takes in consideration of whether you're a sports person, what is your occupation, how much is the demand on the shoulder, and whether there's arthritis or any other problem. So doctor decides what is best for you and accordingly chooses treatment for you. Therefore, we can say rotator cuff injuries at different ages in different situations have to be dealt properly, but after proper treatment with good rehabilitation, end result is good, better than what it is when they are left untreated. Thank you.